All right.
Got it.
Welcome, everyone. I'll start with the always a pretty short introduction of our guest today, which is who is Jessica Jones Nielsen. I think she will do a much better job of introducing herself during the talk, and you'll get to know her quite a bit. I remember from last year's talk, which I really enjoyed, that you have integrate a little bit of your backstory as well. So I will not say much about you, other than I'm very excited that you're here. You're just recently been promoted to reader, which is very exciting.
Thank
Congratulations to
you.
that. And you're also named, I think, City's Extraordinary Woman of the Year or something like that, which is also
Something like that.
something which probably you wouldn't mention, so I mention it. So you are a accomplished and valued member of the City University, and you are a counseling psychologist, and that's today the main reason why you're here. And we're excited to hear a little bit more about you. I said it before, and I think most of you were already there. If you have any questions during the talks, I will monitor the chat, but it seems like Jessica is so multitasking, talented, that she can also monitor the chat. And if you have any questions where I feel like, oh, it would be good to kind of stop and interrupt, then I will stop and interrupt, as rude as I am. And then, and if not, some questions might be just, they're very specific. I would just ask them at the end. I have some questions that two or three questions that I want to ask at the end, because some students contacted me already with them. And so it would be good to kind of get them off my chest, so I know what I'm telling them. So without much further delay, Jessica, I can't clap. I could clap. I can clap. Welcome. And
Okay.
yeah, please take it away.
Great. Okay. So I am sharing my screen, hopefully. Can everyone see
We
so
do.
far?
Yes.
And let me just make sure I am changing, because right now you could see kind of my presenter view, right?
No, we
If
could
I do,
just see. No, that
oh,
was perfect. Yeah.
oh,
Could only
sorry.
see your slide, not your notes.
Okay, hold on. I've done something funny. Just bear with me because I am not Lord. Okay. Okay. So actually, let me just start that again because for some reason I have lost my screen. You guys can see my PowerPoint slides still, can you?
No, now we can only see you. We just saw
Okay.
yours, but then someone, I don't know, like I think you should stop sharing. So you would have to
Yeah. Okay.
click on share screen again.
Okay.
Here we go. Now we see a really
Right.
cute kid.
Oh, yes. Okay. Okay. So let's see. Let's
Yes,
see.
yes, perfect.
Okay. And oh, I know what I did. Okay, there we are. Okay, so do we see a little bit about me?
Yes, but now we see the presenter mode.
Okay. Oh, you see the presenter mode.
Yes, I
Okay.
don't know. Yeah. Uh,
Sorry, guys. Okay, here we
that's
are.
perfect. That's perfect. Please don't
Okay.
touch the computer again.
Okay, excellent. Look at me and my troubleshooting abilities and skills. Okay, everyone. Well, listen, thank you so much. I really appreciate being here. And I've done this a couple of years now just because I'm so excited about what I'm able to share with you and bring a little bit more about who I am as an individual, but also who I am as a counseling psychologist. And, this is something I think as an undergraduate program here at City, we try to do is really inspire and get you to understand what options are available once you undertake your degree in the BSc psychology degree program here at City. So hopefully today what I can do is pique your curiosity and just make you think a little bit more about the field of counseling psychology, specifically what it might take for you to become a counseling psychologist one day, and perhaps maybe inspire you with some of my own steps that I've taken to come to this point of my career that I'm so proud about and that I'm so motivated to kind of just share with others. So as you have learned from Andreas, I am a counseling psychologist. I'm also a reader, also known as an associate professor in psychology. And I serve as a senior leader as the Assistant Vice President for Equality, Diversity, and Inclusion here for the university. So that means I work very closely with our university's president and his executive members on the senior leadership team to help support embedding equality, diversity across the range of different structures of the institution that affects your experiences as students here in City, as well as staff members who teach you, who support you, who provide provision for you. But I won't go into detail around that. That's for another day. But what I want to really get you to understand is really sort of the steps that I've taken in order to become a counseling psychologist and what steps you can take to become one too. So before I begin, I just want to share a little bit about me because I think it's always about reflecting on who you are as a person and also how your life has really influenced the decisions you'll take once you complete your degree in psychology. Maybe like some of you in the audience, I'm a child of immigrants. My father is from Bermuda and my mother is from El Salvador. She came to the United States fleeing from a civil war in her country, where she met my father, who was just trying to find opportunities as a Black man in the state of Virginia. They fell in love and had me as a little child, and I was the first in both sides of my family to go to university. So my alma mater is University of Florida in the state of Florida. And I pursued a PhD degree because I fell in love with the discipline of counseling psychology. And you'll see me there next to my PhD supervisor, Professor Carolyn Tucker, who really inspired me to think about how, as a woman of color, I can impact the world and the society around me, but also to directly work with individuals in a psychological manner on a day-to-day basis, but also infusing that with research. And I'll talk a little bit about the different routes counseling psychologists can take and the different types of roles that they can obtain whilst studying, but also performing as counseling psychologists. So I ended my PhD degree by fulfilling my requirements of my psychology residency at the Duke University. And then at that point, I had kind of other critical life experiences that have influenced and shaped the way in which I've become a counseling psychologist. And one is that I ended up falling in love with somebody who decided to move to the UK. So whether you're here for love or whether you're here because your family has moved here or you've been born and raised here in the UK and here in London, that has shaped the way in which I think about my career as a counseling psychologist. Because I wasn't able to practice or see clinical patients in the way that I could have if I stayed in the US, I ended up having a research-based position at Imperial College as a research postdoc. But then at that point, I was able to situate myself and be recognized by the HCPC and the BPS as a registered counseling psychologist, which then led me to my first permanent role as a lecturer in psychology here at City University. And that was in 2011. And since then, I've been really committed to supporting and shaping trainees in our counseling psychology program, which I'll talk a little bit about in the future slides, but as well as aspiring to be the next senior leader within the institution. So have really advanced in that route by obtaining an associate dean position as well as a university assistant vice president position. So that's just a little bit about me, where I came from, where I've been, and where I'm at now. But I hope in the next couple of slides, I'll be able to talk to you about what is a counseling psychologist exactly, how do they work, as well as how can you equip yourself to become a counseling psychologist and the various training paths you can consider taking. And if there is time for question and answers, I hope to be able to answer your questions towards the end of this presentation. So just to begin with, what is counseling psychology exactly? Well, we are based on the psychological principles that meet counseling and psychotherapy. So counseling psychology has its roots in psychology and in the tradition and theory of counseling. We work in many different settings, such as in mild, moderate to severe and enduring mental health settings, as well as hospitals, schools, and colleges such as universities, prisons, companies, as well as private practice. And I'll speak a little bit about private practice towards the end of this presentation. Both counseling and psychotherapy are umbrella terms that cover a range of talking therapies. So if you've never experienced therapy before, oftentimes you would meet with a professional who would be able to, walk you through different types of treatment approaches or therapeutic approaches to help support you addressing, areas or issues around anxiety, depression, bereavement. But we are all trained practitioners who work with people in short or long term. We also are about bringing effective change through different types of specific approaches that are underpinned by evidence or underpinned by theory. Again, these definitions vary between different disciplines, so between counseling, between psychotherapy and counseling psychology. But overall, I think we aim to achieve the same thing. So counseling is a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. And so you'll note that that particular definition is by the American Counseling Association website. And there's a real emphasis on empowerment of individuals, families, and groups. So really hold on to that word, because that's essentially the root of why I came into counseling psychology. Oftentimes, when we ask students, why is it that they would want to pursue a degree in counseling psychology, particularly our year 3 students or those kind of in between different degree training programs, oftentimes what we hear is because they want to find out how people work, right? Or they like the idea of diagnosis and how to fix people, or that they want to do research that will save people's lives, as well as they want to earn a lot of money and help at the same time. And that last bit is a bit funny because oftentimes it's very difficult to find those really well-paying jobs. But that's, again, a conversation for another time. Um, when we ask specifically why is it that counseling psychology is important for them, and why is it that we want to specifically enter into the field of counseling psychology, oftentimes what we hear is because I want to help people. So essentially an altruistic approach to wanting to kind of bring people, uplift people, and bring them satisfaction in their life. They also want to give back to the world, and they also want job satisfaction. So there is something fulfilling about being able to help others that enable them to feel satisfied with the day's work that they might do as a counseling psychologist. And mostly what we find is that people have had therapy before, and one way or another, that therapy has been so instrumentally, life-changing, that they want to be able to do the same for others. So how does counseling help? And if you haven't tried counseling or therapy yourself, what are the reasons why people come, and what is it that they get out of it? Well, this is just a comprehensive list of some of the reasons why people end up trying to see a counselor or a counseling psychologist or a psychotherapist. But really, it's about gaining insight into one's own issues and problems, to increase their self-awareness and their self-acceptance, or to actualize their desires or dreams or passions. People come in to be able to solve their problems and really tackle some of the real kind of tensions that they experience, and also to kind of bring in heightened awareness around impossible issues that they face on a day-to-day issue. So for example, for university college students, test anxiety has been a subject in which I've been able to provide some of my clients in the past around how to address test anxiety, how to prepare them for managing the way in which they feel stressed when they encounter the testing situation. So giving them some education around what that means and why it is that they're experiencing it, but also information in order for them to tackle those issues on a day-to-day basis or during testing situations. For those who might have experienced anxiety or depression, and really have moderate to severe issues, then there's cognitive and behavioral change interventions that a counseling psychologist can provide in order to address those. And then, as I said before, with regards to empowering individuals, families, and groups, empowerment is a real big kind of the crux of what we do as counseling psychologists, is to empower others to be able to help themselves in situations outside of the therapeutic setting. So really being to enable them to have the tools to carry out those changes on their own effectively and competently. So I won't bother you too much with the definition any further around counseling psychology, but just to note that we as counseling psychologists, according to the British Psychological Society, tend to work with clients who to examine mental health issues and to explore the underlying problems that may have caused them. We also deal with a wide range of mental health problems concerning bereavement, domestic violence, sexual abuse, traumas, and relationship issues. Now, if I had a penny every time someone came to me with relationship issues, I probably would be a millionaire. Because fundamentally, it's really about connection and really being able to enabling people to connect with others. And that tends to be the fundamental root into why people seek out counseling or psychotherapy. We also understand diagnosis as well as the medical context to mental health problems, and we help individuals to work through this through their unique subjective psychological experience. So, meaning again, really centering the lived experience around those who are experiencing mental health conditions or issues, and in order to empower their recovery and alleviate distress. And again, those are some of the kind of descriptions of what we do as counseling psychologists according to the BPS. So I'm also aware that you've heard from a clinical psychologist who probably spoke about the specific training routes to becoming a clinical psychologist, and you might be asking yourself, well, what are the similarities and differences? What makes them distinct from each other? But rather than kind of pulling out the distinctions or the differences between these two, I just want to highlight that what you will understand and what you could probably appreciate is that we as clinical and counseling psychologists share a model of practice that really is informed, where research is informed by our practice and our practice is informed by our research. So both aspects of those dimensions of our roles as counseling and clinical psychology is very much supported in the training models that we undertake as trainee counseling psychologists and clinical psychologists. We also work with very similar client groups. We will work with those who are having long and enduring mental health issues. We're also working with bereavement, psychosis, as well as issues around abuse and trauma. So our client groups are very similar with each other. We also have very similar competencies. For example, we're able to carry out assessments and really we're also able to write reports in order to support uh, legal issues that our clients or organizations that support clients face, and then our therapeutic approaches from psychodynamic to person-centered to CBT are often very much aligned with each other when working with our clients. So specific differences might be in the theory, in what clinical and counseling psychologists do, but it's how they do it and where they do it. And these differences may be around how we view people and the nature of distress. So with clinical psychology, the focus is mainly on more abnormal psychology, those with kind of clinical manifestations of anxiety and depression. And we, as counseling psychologists, look at the normative experience of anxiety and depression that we all, as individuals, but also as a human race, encounter on a day to day basis. So it would be very surprising if anyone was to tell you that they've never experienced an ounce of anxiety in their life or distress in their life. So we tend to work on the normative range of those experiences and not so much on the abnormal clinical range of those experiences. We as counseling psychologists are also expected to be reflective practitioners and really understanding how our own role impacts or influences the way we understand the shape of the client presentation. So we take very much that reflective practitioner role about how much influence we're bringing into those encounters with our clients or the way in which we conduct our research. We also think about how we influence the kind of the interpretation of our research as well. But many clinical psychologists will also think and practice in this way too. So that's to say that we are not rigidly fixed in these different approaches and models in the way that we comport ourselves as psychologists. But the differences are probably becoming more and more minimal as time goes on, and our training kind of frameworks tend to align more and more, given the fact that we are post-pandemic, and we're very much as a field really encountering a lot of psychological burnout of mental health practitioners. So we do need to find ways that are going to be supportive of both clinical and counseling psychology training, so that we can really provide that support that our fields will need in order to really address the mental health crisis as a result of the pandemic. But one element that I think we don't really talk about, and again, something that really has resonated with me and has really turned my attention to counseling psychology over clinical psychology, because I did consider both of these routes myself, is its focus on social justice as central to the counseling psychology ethos. And so there are a few key principles as counseling psychologists and counselors that we keep in mind with regards to the way that we work with our clients. And these core competencies are about an ongoing self-examination of the counselor's own knowledge, awareness, and attitudes around social inequality, and also about sharing power with clients and working in a collaborative manner that builds on a client's strengths, as well as facilitating consciousness raising in clients to allow personal issues to be viewed in their social, political, and historical context. And then finally, leaving clients with the tools, as I said to you, about empowering with social change. And as a woman of color, I have found that this to me gravitated towards the types of values I wanted to see myself in my profession, as well as my career as a psychologist. And they really spoke to me, given the experiences of my own social network, my own social community, where I've seen inequalities impact my family members, my community members very directly, due to the lack of access of being able to utilize mental health services, as well as the impact stigma within the community and outside of the community on people of color have had in shaping the way that we look for help, but also live with those types of mental health issues. So the second principle is around being able to actively advocate on behalf of the needs and interests of client groups or of individual clients within specific organizational contexts. And again, that the term around advocacy and empowerment really spoke to me as far as the kinds of values I wanted to see lived out in my career choice, and that really enabled me to kind of integrate myself, as well as being able to shape the way that I wanted to fundamentally impact the people that I'm serving. So again, social justice is a core value of and goal of counseling psychology, and has been over the last 2 decades. Also, in addition to this, and this is one of the papers that I helped write when I was first doing my PhD under my supervisor, Professor Carolyn Tucker, is that there are different roles that counseling psychologists can take in health inequalities research. So as an academic, I've also been able to research and to investigate areas that really impacted me personally and my community personally, but also in ways in which I can help support addressing and filling those gaps of disparities that we see between marginalized and disenfranchised communities with predominant communities. So counseling psychologists have the training and the experience to contribute more significantly to health psychology and other related health fields, and to help the elimination of health disparities more specifically through a range of interventions. And these are some of the roles as counseling psychologists that we can undertake, and we've listed them in the paper that I've put up there in the previous slide. But mainly just to bring your attention that we're not only just focused on research, but also being consultants and coaches and advocates, as well as health counselors and psychotherapists within the communities around us. But as I have, really taken a keen interest in, is the healthcare research, where I've been able to evaluate specific outcome interventions in order to really illustrate the impact of culturally competent or culturally sensitive training for both providers and patients, which I've published about or published on a lot. So something else I would like to share with you, and let me just check the chat to make sure that we're okay. Yeah, great. And let's see the time. Just don't want to go over. Are we good for time? Yes.
I think we're very good for time. I think there's some
Okay.
questions that were directly asked to me just about the doctorate, but I know that you'll get to that.
Yes, I am going to get to
So I
that.
think I'll just, yeah, I
Okay.
just told them, hey, hang in there.
Hang in there, folks. I'm getting
Yes.
right to it. Don't worry. I'm going to
Okay.
tell you everything you need to know.
Okay.
So you'll
Great.
be very clear when you come out of this talk. So just to kind of give you an example of the type of research I do now, presently, I'm working with King's College on a funded project called Tackling Inequalities and Discrimination Experiences in Health Services. This is the team that I work with. It's the PI for this research is Professor Stephanie Hatch, and I'm one of the co-investigators and consultants for this piece of work that we do collaboratively together. The TIDES project or program is really under two different phases. And right now we're conducting research under our second phase, which is identifying and mitigating the impact of COVID-19 on racial and ethnic inequalities experienced by health and social care staff. And just to kind of say just a bit more about the research and why I've been involved as a counseling psychologist, but also why this, fundamentally links with the way that I identify myself as a counseling psychologist and operate as a counseling psychologist. Sorry, sitting in the dark. Apologies. Is I'm able to really think about sort of those social but also psychological aspects of marginalized ethnic minority communities that oftentimes are not really brought to awareness in kind of areas of health research. So just like the kinds of research that you probably read about or that you've have noted in some of the talks that you've had, we've taken a quantitative approach to understanding the impact of COVID-19 on health and work experience of NHS staff specifically. So as a consultant stroke co-investigator, I've been able to influence the types of questions that we've asked, but also to kind of understand sort of the psychological models that we could take in order to really understand the shape of psychological impact of COVID on NHS staff. So that's one way I've influenced this piece of work. Secondly, as I've shared with you, part of what we do is we're able to really bring in a reflective piece in kind of the client work we do. But equally in our research, we are also able to bring in reflective practice in the research that we conduct. So by using qualitative research, not only are we able to understand the lived experiences of those who we are investigating work around, but we're also able to really take that reflexive approach to understand how we're interpreting and making sense of the interviews that we conduct with our participants. So in this case, really shaping the interview questions, but also having that reflective practice experience to really understand what the interpretation of these qualitative data enable us to do, strengthens our research when we integrate it with our quantitative study results. And then lastly, the third piece is really about being able to kind of develop and design a virtual reality intervention that is an immersive virtual reality training that provides scenarios that are based on the qualitative interviews that we've conducted with our NHS staff participants. And this particular intervention is called Walking in the Shoes of. And something, again, by being able to use the types of skills of working with our key stakeholders, as well as our opinion groups that we've incorporated and worked with, we were able to identify that there is a traumatic experience of talking about cases of discrimination and racism. And when you talk about them, it is re-traumatizing. So in order to take away the onus and the responsibility of those who have experienced these, rather than asking them to tell their senior managers or tell their senior leaders over again and reliving those traumatic experiences, it was brought to our attention that by having a virtual reality scenario, we could take that burden away from participants and put the onus and the responsibility back in the senior management and leaders' hands. And so the walking in the shoes of enables managers and senior leaders to really to kind of immerse themselves on the kind of day-to-day experiences of discrimination and racial injustice experienced by staff members when coming into contact with their patients as well as their co-workers and managers. And these scenarios are intended to be as realistic as possible, really highlighting some of the complexities and challenges that NHS staff face, and specifically ethnic minority NHS staff face when encountering others who are perpetuating discriminatory behaviors. So that's just a couple of ways I've been able to influence research using my counseling psychology skills. Now, a lot of you are probably waiting for this, but again, the path to becoming a counseling psychologist isn't really a direct route, and many take many years to decide that this is what they want to be. It's a decision not to be taken lightly, mostly because it's one of the most highly regulated and recognized qualification in the UK. Also, by determining that you would want to encounter this particular type of degree as part of your career portfolio, there's a lot of investment in time and training and studying that you would have to really consider before taking the steps towards it. So this is just a real quick kind of highlight around how to get to the path of obtaining a degree as a counseling psychologist in order to practice or to research in this particular discipline. And the first path on this road is to obtain the graduate basis for chartered membership from the British Psychological Society. So since you are a city student within the degree program of our BSc here, you have already accomplished this task once you have graduated from this particular degree program. So the BPS is a professional body and learned society for psychology in the United Kingdom, and it was established in 1901. It's supposed to promote an academic as well as applied psychology, and it currently has over 50,000 members, and it makes it one of the largest psychological societies in the world. And there's two routes possible to obtain the graduate basis for chartered membership through the BPS and on the basis of UK qualifications. But the most common route is to complete your undergraduate degree in a psychology program that's accredited by the BPS, which our city program is. A lower second class degree classification or above the required qualifications is also noted. But again, it doesn't have to be a single honors degree in psychology. It could be a joint degree with another subject. But in order for it to be accredited, you have to have been exposed to the core curriculum specified by the BPS. And that's something that the process of the BSc has already undergone and has already, I think, confirmed as of last year. So well done to the BSc group for doing that and maintaining that status. So again, just so that you understand that this is just a simplified version of the route that you could potentially take. Many people take alternative routes, actually go outside of the discipline of psychology, come back in and become mature students or trainees at a later point. But this is just really to kind of give you a sense of the direction of travel, where, we would expect you to kind of create a comprehensive work of experience portfolio. And that means really kind of thinking about your voluntary experiences, your work experiences that show that you've been immersed inside of mental health setting, providing face-to-face interactions with clients or patients. And so the doctoral level training in counseling psychology is typically 3 years, but it can be longer depending on whether you're taking a full-time or part-time status, and that varies from program to program. But once you have graduated from your doctorate, you would have full recognition as a counseling psychologist by registering yourself in the HCPC, which is the Health and Care Professional Council. And then also full recognition is brought to you by chartered membership in the BPS division of counseling psychology. So the counseling psychology training program at City is one of the leading counseling psychology or doctorate of psychology programs in the UK. It currently has a course that is research focused. So primarily we are scientist practitioners at the core, and that's who we train. And we seek to train people in CBT, cognitive behavioral therapy, psychodynamic, and person-centered models. As I said, it's a 3-year full-time professional doctorate program with no option for a part-time degree. But it is approved by the Health and Care Professionals Council and accredited by the BPS, like the undergraduate psychology program. It's one of the first courses to be accredited by the BPS in 1995. So we have a long and standing recognition amongst our program peers in the nation to really bring high caliber and to develop a highly skilled counseling psychologists once they graduate from our program. So the training practitioners, just to kind of give you a sense of what they experience in the 3 years in our program, in their first year, they study the theoretical underpinnings of the 3 main theoretical paradigms that are in our discipline of counseling psychology, and that is person-centered cognitive and behavioral therapy and psychodynamic. So that's in the first year of the doctorate program. Trainees then specialize in at least one further model, and they should be expected to have a working knowledge of and supervised clinical experience in at least one model further during their final 2 years. So you might start off with person-centered in the first year, but then over the next 2 years, we would also start specializing in cognitive behavioral or psychodynamic.
Jessica, could you say one, like, if
Yeah,
I just want a
yeah, go ahead.
practical thing, like
Yeah.
from 5 days, like how often would you be at the university, and how
Yeah.
often would you like? So, I think that's something that's often like
Mhm.
students really interested in, kind of like,
Yeah. So it is, like I said, it is a full-time degree program, training program, but it varies from program to program. Here at City, we expect our trainees to come into the campus at least once a day, one day out of the week. So a typical day would be that our first year trainees on the 3-year program would come on a Wednesday, and they would have their modules or courses between 10 a.m. until 5 p.m. And that would typically be between three modules per day. And then in between, they would have supervision and other types of supervised and reflective practice
mm,
spaces. So in between those 3 modular courses, they would have kind of reflective spaces or a reflective supervision meetings. Now, that's just one day for kind of academic attendance. The other days, they're required to be on placement for between 1 to 2 days per week. And that's just to be able to kind of maintain the number of hours that is required of them per year once they go through the degree program. We often say that if you have to work full time, um, and again, this is really kind of a social issue, I believe, but if you have to work full time in order to do the degree program, then oftentimes that won't work because there will be conflicting or competing interests with regards to fulfilling the work requirements that you have personally, but also the requirements of being on placement and undertaking your studies. So we definitely, understand that sometimes financially it's not a feasible training experience for most people until either one, they've saved up money to come onto the course, or two, that they have supplemented that kind of fees through other routes. But we do often say that it's a full-time course and that there wouldn't really be any room for additional further working. Does that answer your question, Andres?
yeah, I think yes. I think like it's a little bit like normally you would. I thought like you would kind of do one or 2 days, and then you would be on placements, or like how?
Yeah, yeah. So it's
Yeah.
one day of academic study and then 2 days of placement experience.
Okay.
So everyone is required to be on at least one placement every year. But depending on, how well you can get through, the number of client hours per week, it's either 1 or 2 days. Some people, because of just the nature of their placement, they're not able to obtain the right amount of placement hours, then they might have to do 3 days a week. But
Okay.
again, that doesn't leave you time for kind of the research elements of the training program as well. So we're just trying to kind of make sure that people are protecting their time in order to to successfully complete their training qualifications.
Okay, great. I think like one student also asked me, how to obtain the placements. And I know
Oh,
that I think you have two. Oh, you're also, I don't know if you
mhm,
talk about this, but I think
mhm,
at City you have two people dedicated to
mhm.
helping students to find placements. So yeah,
Yeah.
there's support. And I think that might be maybe if like choosing a course, that might be something really to look out to, right?
Yep.
If they have
Yeah.
the ability to, yeah, sorry. Yeah.
Yeah, no, so I mean, so there's advantages and disadvantages to different programs having placement support or being able to provide you with already kind of placements that you just go and slip into. City is very much of the approach that oftentimes what we'd like for those who want to undertake the training with our program, that they have already explored possible placement settings. And
Mm,
oftentimes, what we tend to find is that our applicants have already started working in viable placement contexts or settings, and so therefore they might roll into that to
mm,
that already exposed kind of working practice into their degree program. But that's not to say that we don't provide the support to advise and also to identify potential placements, but
mm.
you would be expected or required to go through the appointment process of being able to be successfully placed in those work settings
Yes, yes.
by going through the interview process and providing an application and your resume, CV in order to obtain it, because they are quite competitive, because people are also making them available to other programs in clinical and counseling psychology programs.
And just like
Um,
some of them are paid and some of them are not
Yep.
paid. Yeah.
Yeah, yeah. So some of them are
Okay.
paid and some of them are not paid. Oftentimes, for those that are a paid placement program, they would have seen significant existing experiences of
Mm,
providing face-to-face mental health counseling or practicum experiences that support the kinds of
mm.
responsibilities that would be required in a paid placement. So what I always encourage, undergraduates to start thinking about is their voluntary experiences and exposing themselves to these services well ahead of time, so that you are in good stead to being able to successfully apply to these paid placements in the future. So if you haven't already started volunteering, definitely there's a case for you to kind of consider that now.
Yes, please. Okay, you please go
Yep.
on. There's one or two
Yep.
more questions about, but I think they're all
Yep.
about like basically
Hmm.
what like connect a little bit to what you were just saying, but
Yeah. Yep.
what to
Yep.
do once you're graduated. And I think that would be
Yeah.
maybe we can pick up
Yeah.
when we're done. Okay.
Yeah.
Yep.
Okay. So, I mean, I guess I should emphasize that the doctorate in professional psychology is also a very research-based degree program. So, a huge element of our degree and training here is about creating practice scientific practitioners, but also making sure that as psychologists that we're research active and that our practice is informed by the research that's developing over the course of our work. And so we are able to provide rigorous training support and also just ensuring that our trainees have the ability to have the knowledge and skills in a range of psychological research methodologies, which include qualitative, quantitative, and mixed methods approaches, and also to help them build the capacity to undertake and write up a piece of independent research at doctoral level that makes an original contribution to the field. So let me just see. So again, here are the requirements kind of spelled out for everyone with regards to what is expected of a doctoral trainee. So you will see that you will have accumulated over 450 hours of supervised clinical practice over the 3 years, broken up into 100 hours in year one, 150 hours in year two, and 200 hours in year three. So all of those hours are supervised by a HCPC registered counseling or clinical psychologist. We're also, whoops, sorry about that. We also expect for our trainees to undertake a minimum of 40 hours of personal therapy. So that is a non-conditional requirement. You will be expected to be able to see someone for personal therapy over the time of your degree training program. And at the end, the trainee is expected to submit a portfolio that comprises of their doctoral thesis. So, as I said, throughout the course of the study in the DPsych, you'll be expected to produce a 40 to 45,000 word doctoral thesis, which includes a publishable paper and a clinical case study that incorporates your approach to counseling. Counseling. Oops, sorry. And then lastly, all modules are core and must be passed. So there's no options to not pass any of them. They're all core requirements that are specified by the HCPC as well as the BPS. And that is for our trainees to be able to be eligible for those statuses once they qualify. So all of this will lead our trainees successfully to gain a chartered membership as a counseling psychologist with the BPS, as well as registration with the HCPC as a practitioner psychologist. It also indicates to anyone who is looking at your CV that you're able to work in a broad range of settings, which includes the NHS, but also independent hospital sectors, the volunteer sector, forensic settings, industry, academia, and finally private practice. And these are the core key eligibility criteria. One is the 2-1 degree, honors degree or above, confirming your GBS registration with the BPS. Again, I cannot place any more emphasis on the mental health experience. So again, that mental health experience needs to be within a mental health setting, and it should be face-to-face, and usually 1 year minimum is required in order to be considered for a place on a DPsych training program. Also, you would want to obtain your certificate level of therapeutic skills training, which can also be offered here at City, but also in other places across London. And then also, what I would like to emphasize is that if research is not for you, then a counseling psychology DPsych program is something that you might need to carefully consider, because you will need the capacity to undertake a research project at the doctoral level, which is a significant portion of the training requirements of our degree program here at City and any other DPsych program across the UK. And finally, for a list of all accredited counseling psychology programs, and just to really understand their requirements specifically, you can visit the British Psychological Society. And I'll make sure to give these slides to Andreas, so you can just click on the website there. But all different programs emphasize different approaches. They might have a particular ethos or kind of, I guess, an emphasis in the sense of what they want to kind of draw their future trainings towards. But all I can say is that they all correspond to the BPS standards of training and practice if they are accredited. So there's a baseline that we all have to ensure that we provide our trainees in the future. And so these are just some resources that I have been able to kind of pass out to my introduction to counseling psychology students in the past. And one of them is How to Become a Counseling Psychologist by Elaine Casket. So I definitely highly recommend, if you are interested in going down this route, to get yourself a copy of Elaine's book. But also there are other resources that are available here on this slide that you can look at. I also wanted to give you access to some of the voluntary sector work websites that I have, seen a lot of our undergraduate students obtain relevant type mental health experiences under, or at least being able to seek some opportunities by visiting these links. So again, I will make sure that these slides are made available for you so you can consider them. But some of these, like Shout, Sane, The Listening Place, Victim Support, these have all been really positive voluntary experiences for our City undergraduate students. And we've seen a lot of these students who have been in these placements come into our program and have successfully worked through our program based on their experiences beforehand. So definitely would recommend those ones. And now I will be quiet and let us go into the questions and answers. We have 9 minutes. Perfect.
Okay. Maybe you want to stop share your screen. That's great.
Okay.
And then I can, yes. So I think I have 2 or 3 questions. One, I was wondering, So basically, I mean, it's kind of interesting to see there's a real overlap between basically what is recommended to do to become a clinical psychologist and a counseling psychologist. So it doesn't seem to be too different. One of the questions, or several questions that I got from students, is kind of like, what should I do once I graduate, right? And I think it's a very, so, I mean, obviously you said you can either do this training course, this 1 year training course, or you gather work experience. You have to have at least 1 year of work experience with the degree, which is like kind of the same as like clinical psychology. For clinical psychologists, we often say, oh, you should try to become a system psychologist. You should, if that it's competitive, if that doesn't work out in the beginning, maybe you consider becoming a psychological well-being practitioner. That is something that gives you experience and pays. If that doesn't work, you could be like a mental health support worker. And if you have zero experience and you didn't take Jessica's advice to volunteer, then maybe you have to kind of start volunteering and build up that volunteering experience to then get one of these like paid like places where you can get work experience. Would you say, like, would you do something completely different, or is there anything else you would add to that if you want to be a counseling psychologist rather than a clinical psychologist?
I mean, I think the requirements are quite similar in that way because the point is that we need to kind of see applicants, future trainees, evidence that they can conceptualize and think through kind of clinical cases in a way that corresponds with the degree program requirements. So it's kind of like you already need to have sort of that baseline knowledge in order to come in and start working in placements already. So if you don't have that, then there is no point at which we can then upskill people to be at that baseline level. So I think just to say that there's really no way to get around it or to do anything different because both clinical and counseling psychology um, uh, disciplines are highly regulated along with I think 5 other specific psychology disciplines. There really is a baseline kind of requirement as far as like what is expected of trainees at year 1, year 2, and year 3. So we do need for our trainees to kind of come in and have that baseline understanding, that knowledge, and those competencies already in place with regards to their exposure to the mental health settings, as well as being able to conceptualize clinical cases, and how one might think about what to do if they were faced with a particular presentation of a client who was suffering from anxiety or depression. How would they think and work through that case and what they would do? And that would definitely come from any kind of work or voluntary experience that you gain prior to applying to the DPsych. So I would say that there really isn't a way to kind of rejig that. I mean, what we have seen is people coming from other allied professional programs, right? Nurses or even doctors have come and retrained as counseling psychologists or clinical psychologists because they find that there's a specific route of impact they want to take and they want to retrain for that very purpose. And then sort of that that kind of face-to-face client interfacing experience dovetails nicely into kind of their preparations for entering into the training programs. So I'm sorry I can't say that there really
No,
is
no,
an
that sounds great.
alternative. I
That's
just
no, no,
think
no,
that
no. That's great. That's exactly
yeah,
right. So there's like basically, I think for me, it's good to know that the
yeah,
advice that I'm giving out to students when they kind of ask me, "Hey, what should I do
yeah,
after I
yeah,
graduate?" That's
yeah.
kind of true, and that there's no real difference in like, oh, this is clinical but not counseling, or this is counseling not clinical. You have to
Mhm,
have some contact with
mhm,
service users or people
yeah.
in need, and you have
But
to.
can I
Yes,
just say something? And I'm
yes, please.
and I'm
I mean,
very
it's
aware
your
of the time
talk.
conscious. No, but I'm just saying, like, I also very much am aware, and I mean, as a woman of color, I mean, this is something, I'm always keenly aware of the fact that, we don't have diversity within both clinical and counseling psychology that reflects the population that tend to utilize or need to utilize mental health services. And I think, there's a real disparity right? Or an equity in the sense of access to these types of doctoral training programs, which, are not affordable in the sense of, getting kind of the oftentimes people don't have the luxury or the ability to go on voluntary experiences because they have bills to pay or they cannot afford it. They have to go straight from the BSc into these programs that are going to either help them earn more or go straight into work that's going to give them a lifestyle that will support them and their families. And I think sometimes, we shoot ourselves, unintentionally in our feet when we are requiring people to do these placements to get this type of experience, but don't afford them sort of the monetary gain that they would need in order to really take those routes more seriously. So I think, as a profession, we need to think carefully about how we're supporting, encouraging, but also challenging the structural barriers that keep us from diversifying our counseling psychology and clinical psychology
Oh,
workforce. So I just wanted to kind of also note that, some of you might be scratching your head, maybe not, but, how am I going to work for free over the next year in order to obtain these experiences that doctoral psychology programs are requiring me to have? So I definitely understand that that is a real issue. I know that is a real issue, but I do want you to know that in the division of counseling psychology, Yatende, who was a past president, or sorry, past president for the DCOP, is looking at how we can find bursaries to support future counseling psychology trainees to apply for our degree programs in the same vein as clinical psychology, which is very competitive programs to get into. But that's
yes,
about addressing
yes.
those
Yeah,
issues.
and the NHS is doing something similar for getting work experience, paid work, like paying
Hmm.
for work experience. Because in the NHS now, it's often like, oh, you can volunteer, happy, come along. We just don't pay
Yeah,
you, right?
yeah,
So that's
exactly.
really good. And I think Amanda, who's our clinical psychologist, she shared some numbers of the like applicants and who got in, and it looks.
Hmm.
I mean, like the NHS is coming a long way. I think it was quite encouraging to
Yeah,
see the
yeah.
latest numbers. So it's a little bit is happening. One thing I'm not sure if you can talk like two things. One practical thing, marks. What if like let's say my marks suck. I do my bachelor for whatever. I mean, I do it
Hmm.
during a pandemic. It impacts me and my family, right? We talked about you have a research project
Hmm.
about this, right? I might live
Hmm.
in a cramped place with shitty internet,
Hmm.
and like, okay, I get a 2-2. What now? Like, how do I kind of like? Is there other ways to kind of get back? Because like 2-1 is always like the
Hmm.
yeah. Like, how can we? Yeah, I mean, yeah. Hannah says, "Thanks for acknowledging these barriers and obstacles." That's another obstacle, right? Whereas, like, it might be if I have less money, less advantage, blah blah blah,
Hmm.
then this might hit me in a
Hmm.
pretty hard. Like, how could we? Like, what can
Yeah,
I do if I'm a student like that?
yeah, yeah.
Um,
I mean, again, like I said, it goes back to kind of inequalities and, disparities in the education, the structures of the education system that creates these degree awarding gaps for specific ethnic groups. And I mean, I'm assuming, people in this room might understand that, there is significant difference between those who get first in honors and those who don't. And, but those are not because of their own individual sort of inadequacies, but there are the structural and the real lived barriers around being able to kind of have environments that are conducive to their prosperity. And so all I can just say, and and just be mindful of this, and I'm going to think about how I'm going to say it, but you're more than just an outcome, a grade. There's so much more that you can show and demonstrate in your applications that will grab the attention of the panel members who evaluate your applications for entry. And I know because I obviously as a program director in the past and also as a member of a doctoral training program, we often will look to other elements or strengths of an applicant. So it's not just about your degree, but it's also about how you performed in specific areas of your degree. So like which ones you did really well with, but also how you talk about what you talk about in your personal statement and use that to your strength.
Mm,
Being able to really highlight and emphasize that despite all of these challenges and barriers, you remained resilient by doing X, Y, and Z, volunteering, or being able to kind of think about this critically, or perhaps maybe you're gifted in research, and have published. I mean, these things all stand in good stead. We're looking for well-rounded, holistic people. We're also looking for people who can bring a diversity of knowledge and understanding of the real-world impacts of mental health on specific vulnerable groups. So we need that, and it'd be stupid of us to turn away people just because they didn't obtain this grade or this mark. And just really highlighting what your talents are and your gifts and your skills and competency beyond just the grade itself. But it's really about articulating that clearly in your application. That's really the only advice I can give to that.
okay, so that's very encouraging, right? It's kind of like if you're, okay, so it's like don't let that stop you, and if you have maybe not the perfect marks, but you might have like other strengths, or you might have a good case for why this actually makes you a better
Hmm.
counseling candidate, because you know how it is to be
Hmm.
affected by all of these things and you found ways
Hmm.
to cope with them. Okay.
Hmm.
So that was actually the question where I thought it was the easy, quick question. Okay. So maybe I want to ask a little bit about the freedom one has in putting a little bit like during the program and kind of expressing one's own interest in terms of, oh, what I want to do, with whom I want to work, how I want to specialize. Because I think, and maybe we can close it with that, because I think that's one of the things which I think is one of the biggest advantages of doing counseling over clinical, because in clinical they kind of run you through 6 8 stations. There's the light in a city university, yeah, and you have no choice, right? You have to do this, you have to do that. You can't kind of say like, oh, I
Yeah,
want to put my main focus there. Could you tell
yeah.
us a little bit about this? How does this, like, how like what kind of freedom one would have if I'm
Mm.
specifically interested, for instance, working more with children, or working more with for instance, kind of like marginalized communities? How could I put an emphasis on that and kind of make that my thing during the 3 years in a doctorate?
Absolutely, absolutely. I think if there's one way that counseling psychology is distinct from clinical psychology is the ability to have that flexibility
Hmm.
in the way that you mold and shape your career. And hence why I was always attracted to this particular career path, because I felt that I was given or afforded the ability to wear many hats along the course of my training, but also now as a practicing, researching, leading counseling psychologist, I'm able to really, you know, live the kind of life and have the career I want because I've been afforded really this diversity and breadth and depth of skills and competencies. So so for me, I think that is distinctly one of the biggest advantages of going down the counseling psychology route. And unlike the counseling psychology training pathway, which is very kind of rigid in the sense of like which settings you work in, which hospitals you're affiliated with, the context in which you work, that is very predetermined by the training program. Whereas here at City, now I can't speak for every training program, but specifically at City, because of our historical links with several services, several community organizations, charities, all different types of sectoral levels. We have placement connections with some of the best placement experiences across London, even abroad. So that we even had one in Ireland. That was interesting. Now, because of the pandemic, all of that's really shifted. But let's just say that we were happy to entertain as long as a robust supportive structure has been put in the groundwork for that
Mm.
trainee in the placement itself. So in that way, our students have been able to really emphasize a career a career-specific training pathway for them. So one of my supervisees who investigated the impact of eating disorders in clinical populations, she went down a very eating disorder specific or specialist route. And so now she is a senior consultant in an eating disorders clinic, or senior associate, I should say. And then that is really kind of shaped by your own experience, but also the availability of the different types of academics that we have in our training program, as well as clinicians and access to clinical services and clinicians that enable that real kind of bespoke training experience. And hence why when our students and trainees graduate, they're graduating to top level employment levels that that we're all very proud of, and that they've done really well for themselves, that they're leaders, consultants, as well as researchers in different sectors. So yeah, I think that's probably one of the most significant aspects of counseling psychology over clinical psychology. Great
All right.
question.
Yes, I think the freedom that always appeals to me, right? It,
Not entirely, not everything, but
yeah, 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 yeah.
within
It's like,
reason, and scope and resource.
yeah, yeah. If you just like,
I'm
I
like,
don't
I'm
know.
being recorded, and let me make sure I
Yeah,
tell
yeah. It's not like, oh, I want to explore acupuncture for depression or
yeah,
something like that. There are limits to that, but within, no doubt.
psychedelic drugs.
Well, that's a big topic.
Yeah,
Yeah.
yeah,
Okay. Thank you so much. I think that's a wonderful kind
yeah.
of last statement. Yes, and I think I see it in the chats, in the
Okay. No,
chat.
and thank
She said,
you for
and
those of you who stayed on. I really appreciate it. I know it's late in the day, and thank you so much for your attention.
all right, and I'll stop the recording.